Hello, my name is Gabrielle. I'm an intern for Fartoon, and we'll be introducing the speakers tonight. Please join me in welcoming our first speaker, Rahel Ghebre.
Hello, I want to thank the Somali Women's Infertility Support Group for putting us together here and bringing us to talk about what I think is a very important topic, not only for the Somali community, but really for all women and all couples. My name is Rahel Ghebre, and I am a physician and I work at the University of Minnesota, although I've worked with many different physicians over my time. I am both a practicing physician and also a teaching physician. And my colleague, Dr. Amina Warfa, who is Somali and who is an obstetrics gynecologist and has a very big interest in this area, couldn't make it this afternoon, but I believe you'll find her very useful if you ever seek her advice. The topic infertility is a difficult topic to talk about, especially in such a public place. So we should really recognize the courage and the strength of the organization for being willing to have this conversation in such an open manner. Infertility is only recognized when a couple is attempting to have a pregnancy. And technically, in the medical field, we say that infertility only is picked up after a couple has really been trying for 12 months. But truthfully, what we see when we care for patients is couples often come after having tried a lot longer than that and having tried many traditional and non-traditional ways to help the problem resolve. And often by the time they come, it's a very stressful situation between them and between their families. So it is really a very common problem, and I think the first goal of this organization should be to make it so well known that there should not be many reasons why people can't seek care for that. So infertility is thought to occur in about 1 to 2 per 10 couples, at least in the US. We don't know anything about the numbers in Africa, where there's not very good data kept, or in Somalia specifically. But when you think about the US, when you think that maybe 1 out of 10 couples has it, and we probably all know about 10 couples, so there's going to be 1 or 2 among that group, and that 1 or 2 can be us. So the problems that lead to infertility don't just occur when the couple is trying. They could have started way before they came to the relationship. And many reasons are never found out, so there is no explanation. But sometimes there are explanations, and some things can be done before, in this case, before the woman is married. And so I want to just take a few moments to talk about how infection affects problems with being able to get pregnant. Infections, we understand now, sometimes the woman knows that there is infection, and sometimes the symptoms or the signs are so low, you may never know. You can't remember when you think back and you say, have I ever had an infection? The answer may be, I don't think so. I don't ever remember having it. So just because you didn't remember it doesn't mean that infection couldn't have occurred. And the infection is important because the process of the sperm and the egg, in a technical way, meeting and fertilizing and being able to get pregnant, I personally think it's a very magical process. There's so much mystery in it. I sometimes wonder how is it that so many of it ends up being normal. There's so much science that is yet to be understood about that process. But we know for it to occur, there must be a meeting of the sperm and the egg. So in the normal woman's anatomy, where that meeting happens and where the egg starts are separated. So you can think of it of 2 cars that are in separate highways that they must come to a point in which they meet. And the meeting must be just right at the right time with the right temperature. And more so, once they meet, they then have to travel together and they have to make it to the uterus. So just like two cars, they sometimes miss each other. Or in the case of infection, what it causes is a blockage. There's a blockage and they can't meet. So they're trying, there's nothing wrong with them, but there is a blockage. And how does this blockage happen? Well, that tube that carries the egg, which starts from the ovary, and the sperm that's made its way to the uterus, they meet in the tube. The tube is a very delicate structure. Just even a little bit of scarring can close this very small, what I call kind of a highway. And the scarring could have occurred many years before. So usually what we know is that, at least in the US, every year, about 500,000 women, and maybe more than that, develop an infection at some point. And the infection travels from wherever it starts, usually in the vagina, and it travels up the cervix, and it gets to the uterus. And there's no treatment for that infection, so the infection gets stronger and stronger. And ultimately, it develops in what we know now as pelvic inflammatory disease. So this infection, it's sort of an angry process. It sets up many different components, and it is actually this fighting of the body for the infection that causes the scarring. There's some bacteria that can cause it. Some of them are infections that are passed back and forth between partners, so between a male and a female, and that can be chlamydia or gonorrhea. But other times, it may not be something that's passed between the partners, but it's just a bacterial infection that has developed in the woman at some point. So the problem is when there is a blockage, the woman feels that everything is normal. She feels all the signs of things that should be working well, and the male obviously feels the same way too. And so what we know is that because there are these silent reasons why infertility in this case can occur, and it's not a fault of one person or the other, that there are many different things we can do. In the US, it is now recommended that for girls less than age of 25, they should have every year, even if they don't have any problems or any symptoms, they should be tested every year for infections. And so obviously that means you have to go to the doctor every year. Even if you're not married, you must be checked for this infection. But then, because we know that after 12 months of trying, there should be a problem, there must be a problem. Obviously, women in this organization and myself and Dr. Warfa really feel that for this community, once you're having an open discussion, don't wait too long. Seek the advice. Maybe there is a solution to it that requires a little bit of effort, but has a lot of reward for what is a very magical process, really the birth of wonderful kids. Thank you so much for your attention.